Hi everyone, this is Dr. Jiaxin Shen from Shantou University Medical College. This time, we will turn our attention to platelets. You are expected to state what platelets are and explain how these tiny cell fragments are responsible for blood clotting. Similar to most types of blood cells, platelets originate in the bone marrow from cells known as megakaryocytes, which breaks up into small pieces when entering the circulation. These small, oval circulating pieces are platelets, or formally termed thrombocytes. As you can imagine, being fragmented or in pieces, platelets age quickly and degenerate in about 5 to 9 days if they are not involved in clotting. Thrombopoietin is a hormone produced by the liver that increases the rate of platelet production. A normal platelet count is 150,000 to 300,000 per microliter. This tiny fragment has a whole system in place to prevent you from losing too much blood through a process known as hemostasis. Imagine you accidentally cut your thumb with a very sharp knife. Thanks to the rapid sequence of hemostasis, you would not bleed to die. Basically, hemostasis has 3 stages: vascular spasm, platelet plaque formation, and coagulation. At the very first sign of a rupture, the blood vessel constricts itself to slow the outflow of blood. Smooth muscles in the vessel wall go into spasms or intense contractions that constrict the vessel. If the vessels are small, spasms compress the inner walls together and may be able to stop the bleeding completely. If the vessels are medium to large-sized, the spasms slow down the immediate outflow of blood, reducing the damage while still preparing the vessel for the subsequent steps of hemostasis. These vascular spasms can significantly reduce a blood loss for 20 to 30 minutes, allowing time for the next 2 steps, platelet plaque formation and blood clotting, to occur. In the second step, platelets gather at the site of the injury, creating a plug so as to keep the blood from leaking further. We are lucky that these free-floating platelets don't clump together during normal circulation. But when the endothelial lining of a blood vessels are torn, the underlying collagen fibers are exposed and chemically react with the platelets, turning them all sticky and glue-like at the site of the injury. If the injury is small, a platelet plug may be formed to close the tear within several seconds. Platelets contain secretory granules. When they stick to the proteins in the vessel walls, they degranularize, thus releasing their products, which include ATP, serotonin, and thrombosin A2. You can easily find out that this is a positive feedback cycle. It helps to repair unnoticed daily wear and tear in the smallest blood vessels. But what if the injury is more serious? The fact is, platelets are never strong enough as they could be and need reinforcement to complete the clotting process. So the third stage of hemostasis begins. At least 12 substances called clotting factors take place in a series of chemical reactions that eventually creates a mesh of protein fibers at the site of the injured vessel. Each of the clotting factors has a very specific functions. We will discuss just 3 of the substances here: prothrombin, thrombin, and fibrinogen. When the vessel endothelium is injured, the vessel and nearby platelets are stimulated to release a substance called prothrombin activator, which in turn activates the conversion of prothrombin, a plasma protein, into an enzyme called thrombin. This reaction requires calcium ions. Thrombin facilitates the conversion of a soluble plasma protein called fibrinogen into long, insoluble fibers or threads of the protein fibrin. Fibrin threads wind around the platelet plug at the injured side of the blood vessel, forming an interlocking network of fibers and a framework for the clot. This fiber net traps and helps to hold the platelets, blood cells, and other molecules tightly at the site of injury, functioning as the initial clot in less than 1 minute. These 3 steps work collaboratively to join fibrin threads and protein strands together, creating a sort of mesh that entraps the platelets and blood cells. Eventually, the threads actually pull the 2 sides of the wound together so the endothelial cells can grow back in a repaired blood vessel. A few days later, the blood vessel heals and the blood clot dissolves. This intimating figure illustrates the way clotting factors act together to form a clot. It may be called a cascade, where one clotting factor leads to the next in sequence. Generally, coagulation of blood is described in 3 stages. It may be initiated by either the intrinsic or the extrinsic pathway. Platelet phospholipid is crucial to both pathways. Tissue factors exposed by injured tissues allows the intrinsic pathway to bypass many steps of the intrinsic pathway. A series of activated clotting factors oversees the intermediate steps of each arm of the cascade. The pathway converges as prothrombin is converted to thrombin. The thrombin catalyzes the soluble fibrinogen into insoluble fibrin strands. With the help of calcium ion, fibrin strands are able to tightly bind to each other so as to glue the platelets to eventually form a clot. People with disorders related to hemostasis may have troubles with unwanted clotting or the inability to form clots. Yes, indeed, these 2 major disorders of hemostasis are at opposite poles. Undesirable intravascular clotting means hemostasis in the wrong place. A clot that develops or persists in an unbroken blood vessel is termed a thrombus. If it breaks away and flows freely in the blood, it becomes an embolus obstructing the vessel downstream or a distant blood vessel. This is called embolism. Aspirin, heparin, and warfarin are drugs used clinically to prevent undesirable clotting. While on the other hand, anything that interferes with the clotting mechanism can result in abnormal bleeding. Thrombocytopenia, meaning reduced circulating platelets, is the most common cause of spontaneous bleeding, usually a small red spot all over the body. If the liver is unable to synthesize clotting factors, abnormal bleeding could also occur. In the hereditary disorders known as hemophilia, the patients can usually complete the first 2 steps of hemostasis just fine, but they can't make an effective fibrin clot. Lastly, we have the worst scenario, disseminated intravascular coagulation, DIC, which involves both widespread clotting and severe bleeding. It occurs in critically ill patients, especially those with gram-negative sepsis and acute promyelocytic leukemia. To sum up, now you know platelets are one of 3 types of blood cells that originate in the bone marrow from cells known as megakaryocytes. Platelets are responsible for blood clotting. If a blood vessel wall is injured, platelets will rush to the site of injury and form a plug or clot to stop the bleeding. If platelets count is low, the risk of uncontrolled or prolonged bleeding increases. it's important to be aware of the platelet count, especially if you are considering surgery or undergoing a procedure that may cause bleeding. That's all for this session. Thank you, and see you next time.